Vaginal discharge is a normal and healthy bodily function. The vagina possesses a self-cleaning mechanism. This mechanism produces a mixture of cervical mucus, fluid from vaginal cells, beneficial microorganisms, and dead cells. Cervical mucus contributes to the overall composition of vaginal discharge. Fluid from vaginal cells is another component of normal vaginal discharge. Beneficial microorganisms play a crucial role in maintaining vaginal health. A mixture of fluids and cells contributes to maintaining a balanced internal environment. The fluid-cell mixture helps limit the growth of harmful bacteria. This protective mechanism helps safeguard the vagina from infection. The balanced internal environment and bacterial control are crucial for vaginal health. The vagina possesses a natural microbiome that maintains a healthy balance. Introducing external substances like soap or douches can disrupt this delicate microbial balance. Disruption of the natural microbiome can lead to imbalance and potential infections. Unnecessary washing or douching can remove protective bacteria, increasing vulnerability to pathogens. Maintaining the natural vaginal environment is crucial for preventing infections and maintaining overall health. The vagina is a self-cleaning organ and does not require internal washing with soaps or douches. Fading in dark-colored underwear, especially in the crotch area, can occur due to factors other than washing or fabric quality. The acidity of vaginal fluid is a primary cause of color fading in underwear. Vaginal fluid contains natural acids that can act as a bleaching agent on certain dyes. Unlike harsh washing, acidity causes gradual and localized color changes. The fading is not necessarily indicative of poor quality fabric or dyes. Understanding the cause of fading can prevent unnecessary concerns about product quality. Vaginal epithelial cells contain glycogen. Beneficial bacteria, lactobacilli, consume glycogen. Lactobacilli produce lactic acid as a byproduct. Lactic acid maintains a slightly acidic vaginal environment. The acidic environment inhibits the growth of harmful bacteria. Vaginal discharge acidity can act as a mild bleaching agent. Prolonged contact with acidic vaginal discharge may cause fabric color to fade. Color fading due to acidity is an indicator of a healthy vaginal environment. The acidic nature of vaginal discharge helps maintain a healthy microbial balance. Lactic acid, produced by beneficial bacteria, contributes to the acidity of vaginal discharge. A healthy vaginal pH typically ranges from 3.8 to 4.5. The pfoot sound, also known as a queef, is a type of vaginal flatulence. Queefing is caused by air becoming trapped within the vagina. The pfoof sound occurs when trapped air is released from the vagina. Vaginal flatulence or queefing is not gas from the digestive system. Air can enter the vagina through various activities. Sexual intercourse is a common cause of air entering the vagina. Exercise can also introduce air into the vaginal canal. Insertion of sex toys may lead to air being trapped inside the vagina. Medical instruments inserted during examinations or procedures can also introduce air. The introduction of air is typically harmless and temporary. The vagina is a closed pouch with only one opening. Air can enter the vagina. Any air that enters the vagina will eventually escape. The escaping air creates a harmless sound. This sound is a normal physiological occurrence. The sound is harmless. The change in color of menstrual blood to brown is often a normal chemical process. Oxidation is the primary cause of the color change observed in menstrual blood. Exposure to air triggers the oxidation process, leading to the darkening of the blood. The iron content in blood reacts with oxygen, resulting in a change in color. This oxidation process is similar to what causes an apple to turn brown when cut and exposed to air. The color change due to oxidation does not necessarily indicate a health concern. Lighter menstrual flow causes blood to remain in the vagina for an extended period. The acidic environment of the vagina facilitates the oxidation of the blood. Oxidation alters the color of the blood. The change in color is a result of the chemical reaction between the blood and the vaginal environment. Blood color can vary from dark brown to light brown. The color variation depends on the degree of mixing with vaginal discharge. The duration of exposure also affects blood color. Oxidation processes contribute to the color change over time. Darker blood indicates a longer exposure time or greater mixing with vaginal discharge. Lighter blood suggests a shorter exposure time and less mixing. Brown period blood can be a normal occurrence. A foul odor associated with period blood is not considered normal. Unusual pain during menstruation warrants medical evaluation. Sudden changes in menstrual cycle, length, or flow should be investigated. If brown period blood is accompanied by abnormal symptoms, consult a healthcare professional. Small blood clots can form within the vagina during menstruation. These clots are a common occurrence during the menstrual cycle. Clot formation involves the aggregation of blood cells and proteins. The size and consistency of clots can vary. Factors such as hormone levels and uterine contractions influence clot formation. Menstrual blood, when retained within the vaginal environment, undergoes a natural clotting process. This clotting process is a physiological response designed to reduce blood loss. The aggregation of blood components results in the formation of clumps. These clumps are a natural consequence of the blood's interaction with the vaginal environment. The body's inherent clotting mechanisms facilitate this clumping phenomenon. The clumping of menstrual blood is a normal physiological occurrence. Changes in body position can dislodge blood clots. Standing up can cause clots to be released. Walking may also result in the expulsion of clots. Clots may be expelled during bathroom use. Small to medium-sized clots are often considered normal physiological occurrences. The absence of heavy bleeding alongside clot formation typically indicates a normal clotting process. Intermittent appearance of clots, rather than continuous formation, is characteristic of normal clotting. Clots appearing in small quantities are generally within the normal range. Normal clots are not associated with excessive or continuous formation. Unusually large clots during menstruation can indicate underlying health issues. Excessive bleeding, or menorrhagia, is a symptom that warrants medical evaluation. Clotting disorders can manifest as abnormal menstrual bleeding. Uterine polyps are abnormal growths that can cause heavy or prolonged menstrual bleeding. Uterine fibroids, non-cancerous tumors, are another potential cause of abnormal bleeding. The vagina is a self-regulating organ capable of maintaining its own health. The vagina possesses inherent protective mechanisms to ensure its well-being. This self-maintenance capability contributes to the overall health and balance of the vaginal environment. The vagina's natural defenses help to prevent infections and maintain a healthy microbial balance. Understanding the vagina's self-regulating abilities is crucial for promoting and preserving its health. The vagina's ability to self-regulate is a testament to its complex and resilient nature. Vaginal discharge is a normal physiological function. Underwear discoloration can be a common occurrence and is not always indicative of a problem. Queefing, or vaginal flatulence, is generally a harmless expulsion of trapped air. Brown period blood often indicates older blood being expelled from the uterus. Small menstrual clots are typically normal, especially during heavier flow days. Understanding the human body can foster a sense of comfort and reduce anxiety. Knowledge of bodily functions helps differentiate normal sensations from potential health concerns. Familiarity with anatomy and physiology empowers proactive health management. Increased body awareness can lead to earlier detection of health issues and more effective treatment. Establishing a baseline understanding of personal health is crucial for proactive health management. Knowing what is normal allows for the early detection of deviations from one's typical health status. Recognizing unusual symptoms or changes in bodily functions prompts timely medical consultation. Early medical intervention often leads to more effective treatment and improved health outcomes. Monitoring personal health metrics empowers individuals to take control of their well-being. Proactive health awareness contributes to a healthier and more fulfilling life. Prioritizing self-care involves nurturing and respecting one's physical well-being. Engaging in regular physical activity is essential for maintaining a healthy body. Consuming a balanced diet provides the necessary nutrients for optimal bodily function. Adequate rest and sleep are crucial for physical recovery and overall health. Listening to and responding to the body's needs promotes a stronger mind-body connection. Human anatomy encompasses the study of the body's structural organization. Understanding the body's structure can improve overall health awareness. Knowledge of internal organs and their functions supports informed health decisions. Learning about the body's systems can empower individuals to take proactive steps for their well-being. Visual aids and interactive models enhance the learning process of human anatomy. Continuous learning about the human body promotes a lifelong journey of self-discovery and health management. The module summarizes 5 normal vaginal functions for clarity. Function 1. Maintaining vaginal pH balance. Fonction 2. Providing lubrication during sexual activity. Function 3. Protecting against infection. Function 4. Self-cleansing through natural discharge. Function 5. Supporting reproductive health.